Thank you, Peter. Good evening, good morning, everybody. Welcome to Global Action on Men's Health webinar series and our webinar today on men and cancer, saving lives and reducing suffering. My name's Anthony Brown. I'm the chair on Global Action on Men's Health, and I'd like to welcome you all here today, no matter where in the world you're joining us from. We're quite excited about this webinar, not only because of the important issues that we'll be talking about, but also because we have so many people joining us from all around the world. So thank you all very much. Peter, can we go to the next slide, please? So what I'd ask people to do is to please use the chat function as a way to communicate with us and with everybody. Please feel free to introduce yourself and the organisation you're representing through the chat function. And please use the chat as a way to ask questions, make comments, share thoughts, or have other, or sort of add to the conversation as it progresses and as it takes part. And if there are links to resources or information or websites that you think will be of interest to people, then we welcome you to please add those. We will be saving questions until the end, till after our last presentation. But please ask questions as we go, and we'll do our best to get to everybody's questions. We'll be making notes of them in the chat. This webinar is going to be recorded and it will be posted on the Global Action for Men's Health website, and we're planning that it will last for 90 minutes at the most. So we'll get you back to your day in 90 minutes time. The program that we have today is something I think most of you will be familiar with. If you want to go on to that next slide, please, Peter. After my introduction, we'll be talking Dr. Mo Saab from the University College Cork will be talking to us about improving men's awareness and early presentation. Then Richard Price from the European Cancer Organisation will be talking about putting men on the cancer policy agenda in Europe. Amon Lakil, one of our deputy chairs, will be talking about tackling prostate cancer in Malawi. And finally, Peter Baker, our executive director, will be talking about eliminating HPV-caused cancers in men, followed up by a short video about some of the men's health and cancer work that Global Action on Men's Health is doing, and then we'll conclude with our discussion and questions. So, Peter, if we can go on to the next slide, please. So why are we hosting this webinar? Why is it important? Well, I'm sure these figures sadly won't be a surprise to many of the people who are joining us here today. Globally, we know in 2020, there were 19 million new cancer cases and 10 million deaths. And most of those cancer cases and deaths occur in males. I won't go through all the details that are on the slide, as I'm sure they are familiar to most people, and we'll be providing links to that data. But we know that, again, onto the next slide, please, Peter, we know that in men, prostate cancer, one of the most frequently diagnosed cancers in over 112 countries, and then followed by lung cancer and colorectal cancer. And lung cancer is the leading cause of death in men in 93 countries, followed by prostate cancer and liver cancer. And while these statistics are alarming, we're further concerned at Global Action that men and cancer are rarely addressed in health policy. Be that male health policy, it's one of the few places where a men's health policy exists, or in cancer policies generally, being looking at sort of gender differences and particularly what's happening with men. So Global Action on Men's Health is working with the European Cancer Organisation to put men and cancer on the European policy agenda, and you'll hear a little bit about that as we go along with this webinar. And we have invited two scholars, Natalie Leon and Chris Colvin, who are in the process now of preparing a policy report for us on men and cancer globally. And later on this evening, you'll see a short video about how that is progressing. And we aim to publish that report early in 2023 with an advocacy campaign around men's health and cancer policy to follow. So thank you all very much, Peter. That's the on to the next. Oh no, thank you all very much again for being part of the conversation today. I will now like to introduce Dr. Mohammed Saab. Mo is a lecturer and Director of Graduate Studies at the School of Nursing and Midwifery, University College Cork in Ireland, where his research is primarily focused on the use of innovative technologies such as virtual reality to promote cancer awareness and help-seeking behaviour amongst young men. So over to you, Mo. Thank you very much for your time. We're very much looking forward to your contribution.
Thank you very much, Anthony, and good morning, everyone. I'll just share my screen there. Okay. Can you see my presentation okay?
Yes, we can. It's in presentation. That's it. We can see it.
That's great. Okay. So I'll be presenting on two cancers, testicular and lung cancers, and I know I have 10 minutes, so I'm just timing myself there. So the first part of this presentation will be on testicular cancer and what can be done to promote men's awareness and help seeking for testicular symptoms. Testicular cancer, as many of you know, remains the most commonly diagnosed cancer in men 15 to 35 years of age, with a mean age around 33 years at diagnosis. The risk for this cancer is highest in the US and Europe, predominantly among white men, and the classical symptom tends to be a painless, unilateral painless lump. However, research shows that symptoms of testicular cancer tends to overlap with other diseases like epididymitis and testicular torsion, which tend to be more frequent than testicular cancer. So we came up with the concept of the importance of raising testicular awareness regardless of the ultimate diagnosis, which entails raising awareness of the normal look and feel of the testes and common symptoms. Again, just because the huge overlap between testicular cancer symptoms and symptoms of benign disease. So the project I'll be discussing, I won't be discussing all the steps for this, but this project was underpinned by the Medical Research Council framework. The project is called Enhanced Men's Awareness of Testicular Diseases Using Virtual Reality, or EMAT. I'll be referring to it as EMAT from here on. So we have multiple reviews of the literature, qualitative work with men and co-design sessions, a theoretical framework that we developed and used. We developed the VR game, we tested its feasibility, we ran a small pilot study, and now I'm leading an RCT, feasibility RCT, funded by the Health Research Board in Ireland to test, potential effect over 2.5 years. So what we found in the interviews with young men was that awareness of testicular diseases was lacking, and their intentions to seek help for symptoms were quite low. As you might know, as you would know, there's a lot of embarrassment and stigma around, the genitals and having, the testes checked by a GP, etc. So a lot of the barriers relating to help seeking were around the embarrassment that testicular, clinical testicular examination brings. And also another barrier that we identified was the lack of awareness of the normal feel and look of the testes. That was something that we did not anticipate in advance, in terms of men didn't know what's normal for them, let alone distinguish between the normal and the symptoms. And the man said, it's like looking for a lump in a bag of lumps, which was quite interesting. To raise awareness, however, men wanted any intervention that would be visually stimulating, something brief, not cumbersome. Light humor was advised, but there was a fine line between offensive humor and light humor. They wanted an intervention to raise awareness using, a novel strategy and something that they could access frequently. And they wanted something that is positively worded. You can see the summary there in the figure. They wanted positive wording, no scaremongering or no scare tactics in these interventions. So what we did, we came up with the idea of conducting or designing a virtual reality game that would promote men's awareness of testicular diseases and kind of enable them to seek help without shame, if you want. And this is the third iteration. VR is an ever-changing technology, and there's always new equipment and new software. So this is the latest iteration of the game. Basically, it's an apartment with different rooms. Men go in. We used walnuts initially as a kind of a light-hearted way of introducing the testes. We had symptoms on the walnuts with a voiceover that use a bit of light humor. You see the first two pictures there. We had symptoms then appearing on the normal testes, like a lump and pain with throbbing red light, and they could touch the changes. And then the third picture from the top, and that's a bedroom with, testes hanging, and they could touch the different structures. And the last three pictures there, basically the recap that testes are unique like your fingerprint. This is how you perform self-exam, and you need to seek help if you feel any symptoms. So that takes around 8.5 minutes to complete. So as I said earlier, we tested the feasibility and usability of EMAT, and satisfaction was quite high, and the feasibility and usability scores were quite high. In the pilot study, we had a 1-month follow-up, and we noticed that the knowledge, awareness, and intention to seek help for testicular diseases were quite high. Our feasibility RCT is ongoing with 74 men, but so far the results are encouraging, warranting further investigation and wider implementation of the game. And these are just a few references linked to this project. So in terms of lung cancer, as Anthony stated earlier, it is the most common cancer and the leading cause of mortality globally. And we're talking non-gender specific cancers, in isolation from prostate cancer. Men are more affected than women, with high mortality in men. Typically diagnosed at advanced stages, unfortunately, survival rate is quite low. Early help seeking for lung cancer is problematic as well, unfortunately, with significant delays in the literature between symptom onset to men receiving treatment. There's so many barriers, again, to help seeking, from symptom onset to leading men to seek help, to the primary healthcare professionals detecting the symptom or appraising the symptom as something alarming, to making the referrals, to diagnosis, to treatment. So there's so many steps and layers to help seeking when it comes to lung cancer. So we were funded by the National Cancer Control Programme, which is the main deliverer of cancer prevention services in Ireland. And we conducted 2 studies. The first study was with 46 individuals aged 15 plus who had at least one lung cancer risk factor, living in severely disadvantaged areas in 2 Irish counties. And we conducted audio recorded focus groups face-to-face with them. We finished data collection in Feb 2020, right before the pandemic. So the aim of the study was to explore their awareness, intentions to seek help for symptoms of lung cancer, and strategies, exploring with them strategies to enable them to learn more about lung cancer. So we showed as part of the study, we showed the participants 2 campaigns that ran in the UK, Be Clear on Cancer and Get Checked Early, to kind of get the conversation started around what can be done to promote health. We have so many findings, there's more than this even, but what I'll focus on is the bit in the middle, suggestions for effective public health messaging. So the outcome from the study was that individuals wanted to learn more about lung cancer. They thought there weren't enough information out there. The issue was they wanted a campaign that is multimodal, running nationally, having different formats in print, billboards, social media. They wanted something delivered by the government and quite frequently delivered. In terms of the messages within these campaigns, they wanted messages that were simple, clear, and honest. They wanted something worded positively, no scaremongering them, incorporating a shock element. They wanted something shocking to shock the people, but nothing to scare them. So there was a fine line between a shock and scare tactics. They wanted to put a face to the campaign, featuring a celebrity, healthcare professional, or survivor, and they wanted something targeted. And I remember a quote from a participant who said, I don't want to be told on this cigarette packaging that, smoking makes me impotent. I've been smoking all my life and I have 3 children. So they wanted something targeted to the different age groups. The second study was with primary healthcare professionals. So what we're trying to establish in this project was to establish a push-pull strategy to enable people, to push people to seek help when needed and to help healthcare professionals pull these individuals into their services. So we interviewed 36 GPs, practice nurses, public health nurses, and community pharmacists in Ireland, and we audio recorded these interviews. During the pandemic, they happened online. So the reason was to explore their experiences of referring individuals and what can be done to improve referral from the perspective of healthcare professionals, hence this push-pull strategy. We also showed them these campaigns, and the strategies identified to enable healthcare professionals to pull people were providing information on when to refer the patients. Primary healthcare professionals wanted educational strategies by the lung cancer specialists, professional organizations. In Ireland, we have kind of pre-existing symptom checkers, if you want, in primary healthcare. So they wanted symptoms of lung cancer embedded or a new checklist or algorithm added. Using patient stories to train healthcare professionals and adopting an interdisciplinary approach to educating healthcare professionals. Because the services in Ireland, unfortunately, are siloed. So once, say, a pharmacist refers somebody to their GP for symptoms of lung cancer, they don't know what happened after that. So they wanted an interdisciplinary approach to education. The last bit is what can be done to facilitate early help seeking among patients is the importance of patient education, importance of giving at-risk people access to free screening services, because in Ireland we still don't have a lung cancer screening service, and using family, GP, and community supports to push individuals to seek help when needed. And these are just a few papers published from these projects. Thank you very much. And these are my contact details if you want to be in touch. Thank you.
Thank you so much, Mo, and thank you also for keeping exactly to time. You've set the bar high for our following speakers, so thank you so much.
Thank you.
I've also been monitoring the chat and seeing that we've been joined by people from all around the world. We've got people from Australia, the UK, Malawi, and all around the world. So that's fantastic. And I'd also remind people to please use the chat to post any questions or make any comments. We really welcome that. Now I'd like, and we'll be having a discussion and questions after all of the presentations. Now I'd like to introduce Richard Price. Richard is the head of policy at the European Cancer Organisation. And prior to this, Richard was the policy and advocacy officer at the European Association for Hospital Pharmacists from 2012 to 2017, and policy advisor at the Pharmaceutical Society of Northern Ireland from 2007 to 2012. So we welcome Richard to talk to us about putting men and cancer on the policy agenda in Europe. And as we said before, Global Action on Men's Health has been working with the European Cancer Organisation to raise this issue on men and cancer in Europe. So over to you, Richard, and thank you.
Thank you, Anthony, and thank you to Global Action for Men's Health for the invitation to join you today. I hope my slides are displaying okay. I'm Richard Price, I'm the Head of Policy at the European Cancer Organisation, and I wanted to talk a little bit about how we're connecting with Global Action for Men's Health on trying to put men and cancer onto the cancer policy agenda at the EU level. So firstly, just to say a little bit about who we are as an organisation. We are 41 member organisations, primarily healthcare professionals, advised by 22 European and international patient organisations, with the founding mission of reducing the burden of cancer, improving outcomes and quality for care through multidisciplinarity and multi-professionalism. And we do that mainly through bringing together the cancer community at the European level, trying to forge and agree consensus on particular policy topics, and men and cancer is one of those, and present that consensus to decision makers in order for it to be reflected in policy decision making. Now, the context that we're sitting in currently at the European level is an exciting time. I would like to think partly as a result of representations from the European cancer community. The EU has now seen an opportunity to really make use of its role as a convener of 27 member governments to see what can be done at the European level to strengthen the fight against cancer in all countries. And that was a particular promise at the 2019 European Parliament elections, which is being delivered through what's called Europe's Beating Cancer Plan, and an additional EU research mission focused on cancer. And altogether, that brings a total of more than 50 different initiatives between the plan and the research mission across all areas of cancer care. So a lot on prevention, for example, including hard legislation on areas like tobacco, alcohol, and air pollution. There's a whole emphasis on screening and early detection. And in fact, this month, we've seen quite exciting developments in terms of new potential EU guidance on screening and to include prostate cancer. On treatment, on survivorship and follow-up care, and also on inequalities. And so there's almost a real plethora of choice in terms of places where we could be emphasizing more men and cancer within such important initiatives of the EU. And with that in mind, the European Cancer Organization, with Global Action for Men's Health, conducted a roundtable event with our community earlier this year, inviting patient representatives, representatives from academia, leading healthcare professionals, industry, charities and foundations and others, to really bring together what the state of play is at European level in respect to men and cancer, and what the opportunities that we could work together on are. And this roundtable report that came from the event now is formal policy mandate for the European Cancer Organization, and it emphasizes that we really need this stronger and wider understanding about the excess burden of cancer in men, and that this be addressed as a priority inequalities topic when we think of cancer inequalities. That we need male-targeted approaches across many areas of cancer care, and to promote that sort of thinking more widely in health systems. And that in prostate cancer specifically, we have great opportunities in respect to improving early detection through risk-stratified screening, and the support from our community via this report for that is quite clear. And so we want to see a new European prostate cancer initiative modeled on the European Breast Cancer Initiative. We think that there's much to learn and perhaps to replicate in that respect. So where we are at the present time is, and this is really our approach in many ways on other issues as well in cancer policies, dissecting all of those things that are happening presently in terms of cancer policy development, and looking to find, well, where are the angles and the hooks that we can use to promote better attention in respect to men and cancer. There's a very exciting goal by the EU at the moment to eliminate HPV cancers as a public health problem through vaccination, screening, and awareness and education. And here we are very much fully in force and in support of vaccination for boys across Europe. So we are both working with the EU directly in terms of EU-funded programs to help promote that, but also conducting our own research to highlight where there are still gaps in Europe and what are the barriers that still need to be overcome to see a much greater increase in vaccination for boys. In respect to cancer prevention, I mentioned about a range of legislation being taken forward, but there are also quite a lot of public money being made available to support lifestyle improvements. And this came across very clearly in our roundtable recently about the need for gender sensitive approaches when we think about how we can communicate best with men on these sorts of topics. And I think Mohammed's presentation earlier also indicated about being clever, being strategic, and taking account of particular ways that men may receive information. And so we're busy promoting that to the EU at the present time. This month, we've seen the publication of new proposals for EU agreed recommendations on cancer screening, which would now include prostate cancer alongside breast cancer, colorectal cancer, and cervical cancer. So that is potentially a major improvement in terms of what countries understand should be their obligations in cancer screening. And we're working with the European Association of Urology and many others to make sure that this momentum isn't lost, that when those recommendations become agreed this year, that we start 2023 with a really dynamic sense that now is a time for change in every European country in respect to what they do for prostate cancer early detection. And another major area, it has its own chapter in the Beating Cancer Plan, is very close to the heart of the Health Commissioner, Stella Kyriakides, is combating cancer inequalities. And I believe the cancer community has been successful in getting across that inequalities in cancer at the European level isn't just between countries, East-West divide, it's also within countries related to social groups. And gender deserves its own recognition and understanding, both for men and for women. And we, I think, have been successful in ensuring that the EU Cancer Inequalities Registry will pick up on aspects of that. But in terms of where we want to go next on this, and here we would like to connect with people in the meeting today, at our European Cancer Summit in November, we'll be launching two particular initiatives that link with our Men and Cancer work. One is the publication of what we call a European Cancer Pulse, which will be a repository of lots of additional information about inequalities in cancer in Europe. And we want to make sure that the men and cancer aspect comes across in that. So we'd like your participation and involvement. If you have good data sources that we should be aware of, please do communicate those to us so that those can be captured. And with that data, with all of those information on where the inequalities are most acute, we want to activate political action. So at the summit, we'll also be launching what we call Parliamentarians for Cancer Action. That is national level champions willing to, for example, raise the flag for prostate cancer screening or make sure that public health initiatives reflect some of the gender sensitive approaches that we've discussed already. So we hope you might be able to join us either in person or online and contribute to those initiatives. And before closing, I just want to mention how we do our work. We're very inclusive in terms of how we try to bring in expertise from whichever sources we can are going to benefit our work. We have a range of networks which are open for involvement. If you'd like to be part of our inequalities initiatives, if you'd like to contribute in any of the other areas, be it prevention, early detection, or HPV cancer elimination, please do be in touch, and we'd like to invite you to our meetings, invite you to our discussions, and be part of our policy making. Thank you very much.
That's fantastic. Thank you so much, Richard. There's really a lot there and a lot to think about and digest, and great to see the progress that the European Cancer Organization is leading around men in cancer. And thank you also for also sticking very much to your 10 minutes. That's really, really very much appreciated. I'd now like to introduce I'd like to introduce Amon Lakile. Amon is one of the vice chairs of Global Action on Men's Health and executive director of the Outreach Scout Foundation in Malawi. And we welcome Amon, and I'm looking forward to this presentation on tackling prostate cancer in Malawi. So thank you, Amon.
Hello, thank you, Chair. Anthony?
Yes, thank you.
I hope you can hear me.
Yes, we can.
All right, we in Malawi, I'm representing the Africa region, specifically in Malawi. I have our friends that are joining us in Malawi, and this is 10:31. Might be winding up around the 10:40, around that. So prostate cancer is a new concept as a background in our settings like Malawi. This is why government and other stakeholders do not prioritize it. Prostate cancer is a silent disease and is not being prioritized in most interventions done by government and also non-profit institutions. So we are in the second most common cancer in the main globally as a country, as well as we're also fourth commonest cancer in Malawi. So around the figures talks about 934 new cases per year versus the 554 deaths per year, which is a very big number in terms of the loss of people when it comes to this disease. And 1,384 patients within 5 years. And this is also a big shock when it comes to the gravity of issues like prostate cancer in Malawi. So despite not being prioritized, the disease claimed a lot of lives, according to the latest WHO data published in 2020. Prostate cancer deaths in Malawi reached to 271, or 0.28% of the total deaths. The age adjusted rate, death rate is 13.89%. That's per 100,000 of population, lacking Malawi at 113 in the world. So there's a lot as Malawi we can be thinking about in terms of how the gravity of the disease is claiming a lot of life. And the Malawi position as regard to the Ministry of Health, there is the Malawi government, a national cancer control strategy, which is 2019 to 2029. Their aim that is appears in the strategy at planning, aimed at planning and implementation, cancer prevention, early detection, treatment, follow-up, and preventive care, palliative care interventions at the different levels of governance, and for the efficient monitoring and evaluation of the cancer interventions. When you are going through this strategy, you can't see the much things focusing on the prostate cancer. And again, we are looking at the strategy itself. You see a wrong timing. The health strategy 3 and the Malawi growth and development strategy expired in 2022, while the national cancer strategy expired in 2019. So we are looking at this is somehow a mismatch in terms of when they are trying to implement and have a good outcomes as regard to cancer strategy. But however, we as a country, we need more support as regard to prostate cancer. We need more research on that. we need more to work with the health workers so that we can have a concrete idea in terms of how prostate cancer can be implemented across the country. So late diagnosis due to lack of awareness of early symptoms among patients has led presentation to the hospital. That is also another issue that we could be looking at. A lack of access to diagnosis, diagnostic prostatic specific antigens test in public hospitals. Most patients can't afford private labs. So what is there is that Malawi, as a country, they don't treat the prostate cancer properly unless you go to the private institutions. Yeah, so there's an issue of inadequate knowledge and experience by many health workers and in the country as regard to how do we treat and manage the prostate cancer. So issues of psychosocial and the cultural factors is also another issue. People don't understand. There's need of more awareness on that. So insufficient treatment due to late diagnosis, patients present with adverse diseases already spread to other areas like spine. This information was captured in the Kamzu, that is Mzuzu Central Hospital by Dr. John Mwango. When we are discussing, we emphasized the following points as a very important thing that we are supposed to be looking at the gaps. That's lack of resources, financial capacity, and political will. There is an inadequate political will as regard to the issue at hand. And there is a lot of things that we'll be looking at the negative, the native, only 2 native surgeons and public health services, which is also an issue that the health sector is also facing the challenge in terms of human resource. So when we are looking at proposing the areas of emphasis by government and stakeholders, we are looking at, for example, the donors and civil society organizations. We are looking at increased awareness and of early symptoms and the significance of early health seeking behavior. And we need also to engage community on common the commonalities of these prostate cancer in the country in various areas. Availability and access, that is at the public hospitals. We are looking also at the trainings of health care workers. That's very important. Or the same training of more specialists, urologists, surgeons. That's also very important. Political aware, prioritization, and increased funding towards the prostate cancer and the other diagnosis and the treatment. So we are looking at that as very also key. And what I've done as Autism Foundation, this year, we conducted a joint Zoom with the Global Action on Men's Health, whereby that was part of awareness raising, where we saw a lot of participants in Africa joining the meeting itself, as well as we share information through Twitter and the LinkedIn, and most of the times and the Instagram and our Facebook page as an Autism Foundation. So we also work with other institutions like the Universal Health Coverage Coalition in Malawi. This is also a platform that we do disseminate the information. For example, e.g. mental health was also displayed last year on the Universal Health Coverage Day. So the policy brief that was is shared as well, and as well as sending statement to the Ministry of Health about the monkeypox. That was one of the activities that we've done as an organization. Thank you, Chair. Thank you.
That was
Hello.
fantastic. Yes, no, it just took me a second to get off mute. Thank you so much, Amon, for that really thorough overview around what's happening with tackling prostate cancer in Malawi. You've certainly raised a lot of challenges that we need to look at, and we'll come back to and talk about in the discussion. I'd now like to introduce someone who's known to, I think, a lot of people online, Mr. Peter Baker. Peter is the Executive Director of Global Action for Men's Health, and has been working in the UK and Europe to advocate for HPV vaccination for boys as well as girls. And a lot of this work has been alongside Richard at the European Cancer Organisation. So I'll hand over to Peter now to talk some more about this work. So thank you, Peter.
Thank you very much, and I hope you can all see my slides. I'm going to be talking for the next 10. Yeah, great. I'm going to be talking for the next 10 minutes or so about eliminating HPV-caused cancers, and I've been working in this area for the best part of 10 years now, alongside the work I do for Global Action. So I was part of the HPV Action campaign in the United Kingdom from 2013 to 2020, and that campaign brought together around 50 organisations from a wide variety of backgrounds to try and persuade the government to introduce gender-neutral HPV vaccination. In other words, vaccination for everybody, boys and girls and everyone. And that was ultimately successful. So we were over, it took a long time, but we were able to persuade the British government that vaccinating boys made sense for all sorts of reasons. And I'll say a bit more about what those reasons were. And I'm now currently involved working with Richard and others at the European Cancer Organisation. I work as a consultant for the European Cancer Organisation, supporting the work of their HPV Action Network. And that sort of jigsaw-like logo you can see is the logo of the HPV Action Network, which is part of the European Cancer Organisation. So what's the problem with HPV? Well, there's a picture there of the virus. It looks quite pretty, but it's actually pretty nasty. HPV, human papillomavirus, is a very common sexually transmitted infection that around 90% of people who are sexually active acquire at some point in their lives. It's actually very difficult to avoid. The good news is that most people who acquire HPV suffer no ill effects as a consequence. They will never know that they've been infected. They won't have any problems as a result of that infection, and their immune systems will clear the infection probably within a year or so. But for some people, and it's a small proportion of the total, but it's still a very significant number, HPV can cause a range of cancers and also genital warts, and a very nasty condition called recurrent respiratory papillomatosis, RRP, which is a breathing disorder that can affect people of all ages, including children. HPV causes around 5% of all cancers worldwide, so that is a very large number. And the research points in slightly different directions, but it's thought that between 20 and 40% of all HPV cancers are in men. So we used to think that HPV caused cancer we thought about it mainly as the cause of cervical cancer, but in fact it causes a much wider number of cancers than that, and cancers in all sexes and genders. HPV causes 99% of cervical cancers, 90% of anal cancers, and that can affect men and women, 60% of penile cancers, 70% of vaginal and vulval cancers, and it also causes a number of head and neck cancers, the most significant of which is oral pharyngeal cancer, and 60 to 70% of all pharyngeal cancers are caused by HPV. So you can see that HPV causes or is associated with a large number of different cancers affecting all genders. And it's also been linked to other cancers. The research is still ongoing, so we can't say this with certainty, but there's a possibility that HPV may also be a cause of some prostate cancers, some lung cancers, and some breast cancers. Here's a graph from the United States that shows the trends in incidence of cervical cancer compared to oropharyngeal cancer in men. And you can see that the solid blue line, the number of cases or the incidence of cervical cancer has gone down over the years, while the number of cases of HPV-caused oropharyngeal cancer has gone up. So we can see that while there have been significant improvements, certainly in the States and other countries in cervical cancer, there's still a problem with HPV-caused cancers in other cancer sites. But there is a solution, I'm pleased to say, because all these diseases, most cancers caused by HPV, genital warts, RRP, could all be prevented by vaccination. And that's ideally carried out at the age of 11 to 13. And the reason why it's done then is that's the age generally, but before people become sexually active. HPV is a sexually transmitted infection, so it makes sense to protect people before they can be exposed through sex to the virus. And this is one of the easiest ways of preventing cancer. We think about preventing other cancers like smoking, cutting down alcohol, increasing people's physical activity. Those are all very hard things to do. But sticking a needle in someone's arm is actually really easy. And you can prevent 5% of cancers by doing that. Currently, most HPV vaccination programs offer 2 doses, but the World Health Organization is now recommending that it's safe to cut that down to 1 dose. There is some uncertainty about that, and some organizations, including the European Cancer Organization, are a bit cautious about whether we're running too far ahead of some of the research here. But I think over the next 10 years or so, we may well see a shift towards 1 dose. And vaccination is completely safe. There's been so much research on this that despite the scaremongering, it's very clear that HPV vaccination is incredibly safe. Also, secondary prevention is available through cervical cancer screening and hopefully soon anal cancer screening for high-risk groups. So cervical cancer screening has been around for many years now, but it's possible that anal cancer will be introduced shortly, and that will benefit men as well as women. Why vaccinate boys? Well, clearly there's a significant disease burden in men caused by HPV. As I said, 20 to 40% of all HPV-caused cancers are in men. And it used to be thought that if you vaccinated enough girls, you would protect men as well. But that's clearly not the case, because there will always be some unvaccinated girls who can pass the virus to men. And also men who have sex with men are completely unprotected by girls-only programs. And they are, in fact, that group, men who have sex with men, is the highest risk of the HPV-caused cancers. Leaving men at risk when it's possible to protect them is unethical and discriminatory. And also a girls-only program places the whole burden of vaccination on females. It suggests it's just their responsibility, when, because HPV is a virus that's carried by or can be acquired by both sexes, it really is a joint responsibility, and everybody should share that burden. Vaccinating everyone protects everyone, and faster. Certainly, if you think about just cervical cancer screening, there's very good evidence that if you actually vaccinate boys as well, the rates of cervical cancer will come down faster, for obvious reasons. And vaccinating boys is cost effective. There have been so many studies now that we know that if you take a long-term view, which I know politicians are often reluctant to do, but if you take a long-term view, in the long run, you will save money by vaccinating everybody. So what's the challenge? Well, about 100 countries now have HPV vaccination programs, but HPV vaccination is still widely perceived in many countries as a means of eliminating only cervical cancer. So primarily for that reason, only about 40% of programs at the moment are gender neutral. So boys are only vaccinated in about 40% of the countries offering HPV vaccination. And by 2019, it was estimated that worldwide, only 15% of girls, but even fewer boys, 4% of boys had actually been vaccinated. So there's still a lot of progress that's needed. And it's not only just about getting boys into programs, that's really important, but it's about increasing vaccination rates, because vaccination rates are very low in many countries, and very few reach the World Health Organization's target of 90%. And that's also now the target in the European Union under the Beating Cancer Plan that Richard just mentioned. So what can we do? Well, I think as organizations interested in men and cancer, we can consistently make the case for gender-neutral HPV vaccination and also for higher levels of uptake. We can build on the European Union's clear commitment to gender-neutral vaccination, as well as the existing policies of around 40 countries. This is no longer some weird idea that's been implemented in just a few countries. Gender-neutral vaccination is mainstream now, and we need to build on the evidence from those countries that are doing it, that it can be done and it can be effective. And we need to continue to influence the WHO and other international and national cancer organizations and organizations representing healthcare professionals to get on board with this. And it is a matter of concern that the World Health Organization still hasn't backed the call for gender-neutral vaccination. It still sees vaccination as being just about preventing cervical cancer. But I'm convinced, and this is the lesson really from the work we did in the UK and we're now doing in Europe, that if we collaborate and work together, we have the strength to actually make a difference here and to get boys and everyone into vaccination programs to prevent 5% of all cancers. So I'll stop there. Thank you very much.
No, thank you, Peter, and thanks to all of our presenters tonight who have kept so well to time. As I said, we will be opening up for questions and discussions very soon, so please keep adding questions and discussions to the chat. But now we're going to have a short video that's looking at the policy report that Peter referred to at the start of our webinar tonight, that Global Action on Men's Health is preparing on men and cancer globally. Oh, I don't think the sound's working on that.
Health, in particular HIV and TB, as well as.
Good morning, everyone. My name is Natalie Leon. I do health systems work and evidence synthesis work.
My name is Chris Colvin. I'm an anthropologist, and I do a lot of work on men and health, in particular HIV and TB, as well as evidence synthesis work as well. We're going to give you a quick overview of where we are with these reports. A few months ago, GAMH requested 2 reports on global policies and their engagement with men in the areas of cancer and mental health. We're working most actively right now on the cancer one. And what we're doing in this report is 2 things. One is we're doing a quick sketch of policy documents at the global and kind of regional level to see in what ways, if at all, they engage with issues of men's experiences, needs, preferences in relation to cancer. And because we are anticipating that we're not going to find a lot in those global documents, we're also doing a set of case studies of kind of positive deviant examples, right? Where, ones where countries in particular have done some really good work and kind of looking more in depth and meaningfully at issues of men and cancer. So the report is kind of structured in those 2 kind of pieces, a kind of broad review and then in-depth case studies of some positive examples.
Right, and in terms of identifying the organizations, we're looking at both global organizations as well as regional. We're looking at cancer-specific organizations as well as general health, where cancer is included, especially NCDs, as well as specific cancers of interest, such as lung cancer, for instance. With respect to identifying policy documents within those organizations, we needing to be quite flexible about what we call policies. So some of the documents would be guidelines, strategic plans, and also annual reports if we can't find anything. And just to say that both in terms of identifying organizations and policy-related documents, we're having to use quite an iterative searching process. So sort of following leads that we find within documents and within organizational sites.
Yeah. And as we find these documents and start to kind of pull the information out of them, we're organizing that information essentially along the spectrum. On one end of the spectrum, we have if there are mentions at all of men or male kind of specific cancers, they're often quite cursory and ad hoc. Gender might show up in the list of determinants, or sex desegregated data may appear but not be really discussed. So that's one end of the spectrum. The other end of the spectrum, there are a few cases where men are engaged not only specifically as a particular group, but more meaningfully, kind of the issues kind of unpacked and dealt with a little bit more. So that's the kind of spectrum along which we're extracting kind of information right now.
Okay, and then so we're making good progress with that, and then we will be starting on the case studies after that, and we expect to have a good template then for tackling the mental health and men report subsequently. Thank you very much.
Thanks. Bye.
Bye-bye.
Fantastic. So as people can see from that presentation from Natalie and Chris, things are progressing well as we're putting that report together around men and cancer. And one thing I'd like to ask people on the webinar tonight is, as Natalie said, we are looking for case studies and examples of policy documents to do with cancer that do talk about gender or men, and that definition of policy document is very broad. So I'd invite people, and I'm sure people on the call are aware of such documents locally. So I'd invite people to please to either send Peter information about the policy, or if you're thinking about it now, to sort of, if you could mention the policy or even give a link to the document in the chat at the moment, that would be very helpful as we go through. And so we've had quite a few sort of questions come through, and we'll move now into a discussion amongst the panelists. Thank you for everyone who sent through questions. We'll try to get to everything, but we may not be able to, and what we can't get to, we'll take on notice. And one of the questions that occurred to me just to start with Mo was, I remember when I first started working in men's health close to 25 years ago, in Australia there were some very modest campaigns, public health campaigns, that were promoting testicular self-examination. And I was just wondering, and I just asked Mo where he feels that does testicular self-examination, is that something we should be encouraging men and young men in particular to do on a regular basis? What are your thoughts on that?
Thank you, Anthony. Excellent question there. There's a lot of controversy around testicular self-examination, the scheduled monthly or whatever examination of testes. In the US, for example, the recommendations are not to encourage this practice with the fear of, false positives, etc. While I think looking at Cancer Research UK, there's the kind of, they allude to it without naming it as such. Our own research really, what we're trying to promote is testicular awareness as opposed to scheduled self-examination, because realistically, would men actually age, say, 20 go into the shower every month religiously to feel their testes. I don't think so. Practically, it might be possible. So what we're advising is the importance of establishing a baseline of what's normal for these individuals, and that was the key thing that we found, is that men said, you know, we don't feel them because they're all lumpy. So what are we looking for exactly? So starting from there is very important, as opposed to look for cancer. It's look for any changes or symptoms as you are. Regular self-exam definitely should be done, I think, but realistically, I don't know how practical this could be.
Okay, no, thank you for that. And that, I think, was one of the issues that campaign ran into. Yeah, people, men checking soon after they received the message, but how sustainable that was for people checking regularly afterwards. Yeah, it was something we definitely ran into. And Richard, I'm very curious. It was very it was great to hear about the innovations and the things that are happening in Europe with men and cancer, and really pleasing to see the impetus and the recommendations that's coming through from the European Cancer Organisation. A question that that's been raised is, with the recommendations from the EU that are coming out around sort of the introduction of prostate screening, what will happen next? Are EU member states going to be obliged to follow EU recommendations on this, or what are the next steps that's happening there?
Sure. So I think the EU has sort of, basically, you might say, two different types of power. One is kind of hard power, where they have power over legislation, and they're using that for things like proposals on alcohol labeling or on tobacco and air pollution. But then they have this sort of soft power role, and that can be around framing recommendations, which member states are not legally obliged to follow, but they are considered to be agreed by all countries as to what should be the case. So that puts an onus really back on the cancer community, on men's health advocates, and on politicians who prioritize cancer or prioritize men's health, to really make sure that momentum to achieve the recommendations is achieved. So some background, that there are previous cancer screening recommendations from 2003, which recommended on 3 tumor types: breast, colorectal, and cervical. And even now, although we are nearly 20 years on, not every country has implemented the full extent of those recommendations. So momentum is very important, and that's something that the community itself can create. And to get that momentum, you also need awareness. And that's always a challenge as well, where the EU may produce a superb document, but if in the national capitals that hasn't penetrated and reached a high level of awareness, then the likelihood of it having high impact is reduced. So that's, as I mentioned, something that we really need to kind of be working with stakeholders in every country to get a bit of championing going. But to be fair to the EU as well, they've already committed EU finance to help support the recommendations in a way that wasn't the case before. So I think there has been some lesson learning. And the last point is really about regular monitoring and measuring how countries are getting along. And I think there's a certain amount of formal exercise that the EU will do. And I think that's something like every 5 years. But we think, let's not just leave it at that either. Let's use what's in our remit, for example, our European Cancer Pulse, to be almost annually checking up on which countries are forging ahead, which countries are falling behind. So yeah, there's work to do, but it's good that the door's open.
No, thank you, Richard. And I think in terms of that awareness, and also sort of exerting some local advocacy, it's something that Global Action and our member organisations would be, I think we're in a good position to to help with that. And similarly in other regions around the world around these important issues. And also, so I did have a question also for Amon, with the challenges that you were presenting around prostate cancer in Malawi, Amon. Just curious to know, to what extent are men mentioned at all in sort of existing national health policies or a national cancer plan? Is there explicit mention of men at a policy level or not yet?
Peter, thank you, Peter, for the good question. Actually, to say the fact that men's health are less considered when it comes to national programs as regard to health sector. This is what confirmed by the doctor from Muzuzu Central Hospital, whereby he said much of these interventions are not done by the government itself. If somebody is doing it, is doing it. If a health worker is doing it, is doing it just out of passion to make sure that somebody is helped. However, the government has no program for that. That's why I was calling for the general research. There must be general research or capacity building for health workers, so that they should take it as a priority, as well as the research will form a policy to influence policies and the decision making in terms to when the resource allocation, as well as the government political will taking on board all these things. However, there is the rest support, and that's why we also face the challenges in terms of advocating the same issues when it comes to prostate cancer in the country. Thank you.
No, thank you. Thank you, Amon. And I think that question about so much of men's health being driven by the passion of local people, doesn't matter what level we're working at, it's something that we hear all the time. I think the passion of everybody on this call is what's driving a lot of work to date, has driven that work. So thank you. Thank you. Peter, there's been a question around HPV and prostate cancer. You mentioned there were some suggestions of links, and a question around, just to expand a bit more on that, and are there any studies that have been done that shows the connection between the two?
There are, and there are actually people on this attending this call who are more qualified to answer this question than me. But my understanding is that some studies have shown that the HPV virus is found disproportionately in men who have prostate cancer. It's found in prostate tissue. So there's kind of that level of evidence, but I don't think anybody has yet established a direct causal link. There may just be coincidence that the virus is there, or there may be a link, but that's the bit of research that's missing. But I think there's a strong kind of circumstantial case that there may be a link between some cases of prostate cancer and HPV. And if there is, of course, that would be hugely significant, and it would make the case for vaccinating boys as well as girls overwhelming on all sorts of levels, not only in terms of public health, but also in terms of cost effectiveness. Because if you could prevent even a proportion of prostate cancer cases, that would save health systems an awful lot of money further down the line.
Yeah, thank you. That is interesting, and sort of watch this space to see what happens there with that link. And actually, there has been a note in the chat from Alan White in Australia with the Prostate Cancer Foundation of Australia, talking about that they're currently drafting new guidelines for PSA testing in Australia. And PSA testing was a common theme actually through a couple of the presentations here, and I'd just be interested in people's thoughts about the, I suppose, ways to roll out testing and screening, particularly, it used to be such a controversial thing to say that we needed PCA testing and screening. And I'd just be interested on people's perspectives of what's needed now and going forward. So does anyone who wants to sort of start, or I'll just pick someone at random.
Well, as my mic is open,
Please,
I
Peter.
can kick off, because I think we are seeing now a swing back towards prostate cancer screening. I think the European Union's recommendation is hugely significant. I mean, the concern was that after there was a lot of initial enthusiasm for PSA screening, I don't know, 20 years ago or so, but there was a concern that it was leading to overdiagnosis and overtreatment. And a lot of men who had cancers that may have developed very slowly and not caused them any problems were being diagnosed and treated quite aggressively. But I think now the screening technology has moved on. So not only do we have PSA screening, but we also now have MRI screening. And I think that's what's made the change that enables us to actually detect a lot of cases without necessarily going to biopsy and then on to treatment. And also the success of active surveillance means that people who have localized prostate cancer can also be managed, monitored successfully, not necessarily them having any treatment, or treatment is delayed until it becomes necessary. But others may know or have more expert knowledge than me about this.
If I could, jump in on top of it, agree with all of that, Peter, and but I think there's still a lot of misconception to be challenged about prostate cancer screening. You talk to people sometimes, and they may think it's going back to, reinvigorating what was there previously, and there's maybe not the full awareness of the developments and changes that have taken place in terms of screening and early detection for prostate cancer. So that's going to be part of the picture that we have in Europe, is communicating all of that.
No, thank you. And
so the other thing, Anthony, if I can just jump in there that I missed out there, the other thing, we now have a good risk assessment systems. So we know which groups are most at risk, and we can identify them much more clearly and know where which groups we should be looking. For example, where there's a family history of prostate cancer, where people are from African descent, because that group has a much higher risk of prostate cancer. So we can actually assess the risk of these cancers much more effectively, and again, to ensure the right people are screened in the right way, and without the risk of overdiagnosis and unnecessary treatment.
Okay, no, thank you, Peter. Just wondering, Mo or Amon, do you have any reflections about prostate cancer screening that you'd like to add, or?
Just to reiterate what Peter was saying, the Beating Cancer strategy in the EU, as I was reviewing it for the lung cancer side of things, and there's kind of a strategy for putting together a strategy for lung cancer screening, but there was an emphasis on prostate cancer screening as well. I think it's resurfacing as something important, just to reiterate what Peter was discussing there.
Well, thank you. Thank you. Amon, do you have anything you'd like to comment on with prostate cancer screening, or?
No, thank you, Peter. The issue at hand, I think there's a need of working more closely with the health specialist, and we need to have more of that, because most, for example, in African countries, especially Malawi, we do have lack of that in terms of looking at working on hands-on interventions as regard to prostate cancer. Thank you.
No, thank you. Look, we've also had, there's been got quite a specific question to Mo around validated testicular cancer assessment forms. You've probably seen that question in the chat. I'm wondering if there's anything you'd recommend or point to for particularly around supportive survivorship care that would help in practice?
I'm top of my head, I'm not aware of any assessment tools, but what we're doing now, I'm part of a men's health initiative. It's a funded project by the Irish Cancer Society, and we're running a survivor. It's very new. It's starting this month. We're running a survivorship clinic for men in a local hospital, in a public hospital here, and we're going to be starting with all urological cancers. It's an exercise combined with psycho-oncology based study. We're including all urogenital cancers, so testicular cancer will be included, but there's no specific tool. I'd say predominantly the men will have prostate cancer, given the age group and the frequency of prostate cancer in the country. But we don't have specific cancer-specific tools, but what we're using so far is exercise tolerance instruments, as well as the generic kind of quality of life instruments. But I could look more into it, and whoever asked me the question, perhaps we could get in touch, and I could share the instrument with them.
No, thank you, Mo. We'll do that. We'll do that. There's also a question around testicular cancer, around paying attention to certain risk factors, things like early puberty, and I'm going to mispronounce this, cryptorchidism, which I'm sure I've mispronounced, but just your thoughts on what attention should or could be paid to early risk factors?
Yeah, absolutely. Some factors predispose, men are at higher risk. Not only age predispose them, it's race and some modifiable, non-modifiable risk factors. Cryptorchidism is definitely one of the main risk factors. Just in the interest of time, I didn't mention it, but in the game that we designed, we did include some of the risk factors in passing, when we were giving information. So awareness of risk factors is important, although there's no strict schedule of, feel your testes more if you have these risk factors. But it's just the fact to bring their awareness of certain risk factors, like undescended testes at birth, etc. Having a first-degree family member with testicular cancer increases the risk for testicular cancer. All these are kind of embedded in the messages that we delivered, and they're important to highlight, absolutely.
Thank you. And look, I'm aware of time. We've got just about 13 minutes left, and I would just like to invite each of our presenters maybe to give a bit of a reflection in terms of what we've heard tonight, and the discussion and questions. What you see as maybe one or two key things that we need to do to in both policy and practice around men's health and men and cancer. What are one or two key things you'd like to see implemented in terms of policy or practice, or both? And we might just go in the order that everybody spoke originally. So I'll ask Mo first of all.
Thank you, Anthony. And if I am to sum up, what I've been seeing over the past years doing this research is the importance of bringing men to the table when it comes to anything, policy, practice, etc. These practices, the research, the campaigns have to come from the needs of the individuals. And we're really big here on patient and public involvement, and a lot of my research would have people who had testicular cancer, people who had lung cancer on the team to design these. So it's getting the information from the individual, involving them from the outset is important. The second thing that I found from my is to target as to whatever we're developing to enhance awareness, enhance help seeking, promote, primary care referrals, has to come from from a all these messages have to be targeted. I cannot target an 18-year-old the same way I target a 50-year-old or a 60-year-old. So we have to make sure that we target people accordingly, and we tailor it to different information needs and literacy and health literacy levels. Again, having looked at people living in underserved areas in terms of lung cancer, we had other things in mind stepping into this community, but they had their own agenda and their own needs. So I think the importance of targeted messages is quite important in this research or this field.
No, thank you so much, Mo. And I was really very pleased to hear that endorsement for more public and patient involvement in men's health. We all know it's a big push in health and medical research.
And one last thing, sorry, it's not the men's responsibility only. I think as healthcare professionals, we have a role to play, and that's the whole area of what can we do to enable healthcare professionals to refer these men. There's another trajectory that we tend to overlook. It's like if they seek help, they could be misdiagnosed by a GP or dismissed by pharmacists. So what can we do to enable healthcare professionals to continue this process? Apologies for interrupting.
No, that's another great point. Thank you, Mo. And I'll ask Richard on your reflection. What are the one or two things you'd like to see in policy and practice that you think would make an improvement with men and cancer?
Yeah, I mean, I think on men on cancer and today's event, what I definitely take away is just this value of collaboration and cooperation between organizations, individuals active in the field. I've learned a lot from Mohammed's presentation, Amon and Peter as well, and I hope I can reflect it in some of the work we do at the European Cancer Organization. I hope maybe some of the EU initiatives that I've shared might stimulate people to think about how they might be able to connect with those. And so it's great. We're currently working on a collaboration agreement with Global Action for Men's Health to try to underpin that. Even just the most recent conversation on survivorship and follow-up care, that's triggered thoughts about EU initiatives in that space that we could perhaps think to do more on in terms of promoting men's health aspects to those. So I hope we take this event today as a good basis for continuing to have those conversations.
Thank you, Richard. And Amon, I know in your presentation you included a lot of suggestions, but I'd be very interested in your reflections on what are the things that are most needed in policy and practice now.
All right, thank you, Peter. I'm looking at issues of research for the case of Malawi. It's very key because we need to be basing our arguments on the facts. So we need some sort of research because most of the times we have maybe the absence, the unavailability of studies as regard to the cancer itself, prostate cancer especially in Malawi, as well as awareness raising because people in hard to reach areas, as well as even those in town, they don't even understand that this indeed is a prostate cancer, or because there's no diagnosis systems currently by government itself. Maybe they're putting it at blind eye. Again, issues of the capacity building, which, as I said, is also key as regard to health workers need to be capacitated from the health center and at the community level, so at the national level as well. That is also key, and as well the issues of collaboration as key amongst partners. Through the Global Action on Men's Health, we can influence the agenda to policy, to have a good policy direction. Thank you, Chair. Thank you. No,
thank you, Amon. I think they're all very wise insights into ways forward, and particularly that importance of collaboration. And as you said at the start, the importance of research and starting off from your fact-based ideas about what's going on and what's important, both the basic science and the biology of the diseases and what it means for men and on a sort of individual and cultural level. really important. Peter, I'd appreciate your reflections, and of course you're in a very unique position, Peter, because not only obviously are you so involved and an expert around HPV, but also as the director of Global Action, you hear a lot directly from men's organisations and groups all around the world. So I'd be very interested in your reflections.
Yeah, thanks very much. And first of all, before I make a few comments, can I just thank all the speakers for their excellent presentations and the time you've given to this, and also everybody who's attending the webinar as well. It's fantastic to see so many people here from all around the world and from so many different backgrounds. And I'm actually very optimistic. I know there are huge problems. I don't want to understate them. Countries are progressing at different rates and different levels, and there are some deep-seated problems in many countries. But overall, I'm actually very encouraged by the direction of travel here. I mean, I've been working in the men's health field for a long time now, and most of that time I've spent moaning about how bad everything is. But there are now some things to actually cheer about, where we are actually making real progress. When I talked about HPV vaccination, that's one of those areas where there has been a sea change, I think, over the last five years or so, in terms of understanding the need to protect boys from HPV and HPV-caused cancers, as well as genital warts and the other conditions. So we are seeing real progress there in a way that will save lives and reduce suffering. And I think the recent developments around prostate cancer screening are hugely significant. And we see now that men can be realistically, within the next few years, will be part of several cancer screening programs: prostate cancer, lung cancer, hopefully anal cancer as well as bowel cancer, which men have been part of bowel cancer screening for some time now in many countries. There are still challenges about the uptake of bowel cancer screening in men, but nevertheless, you know, the moves here are, in terms of screening, are in the right direction. When it comes to prevention, yes, vaccination is very important, but we're also getting far better now at understanding how to deliver other behaviour change programs to men in the area of diet, physical activity, smoking, and so on. So, you know, there's really good evidence now, and that's beginning to be implemented. In terms of policy, I think what's happening in the European Union is hugely significant. We are seeing, you know, gender and men as you know, on the radar now with the European Union, thanks to the work of the European Cancer Organization and others. And I think, you know, there's a real opportunity here which we can build on. And, you know, at a higher level still, the World Health Organization, I think, is now much more interested in thinking about what it can do for men. We're having some very constructive conversations with the WHO, both at the regional level and also at the global level, about men and cancer and other health issues as well. I just want to pick up what Mo said about involving men themselves in all of this. It's easy kind of to sit in an office and kind of think about clever policy ideas, but I think we do need to have, you know, make sure that men broadly are involved and consulted and engaged in this process and listened to. So that's what you're doing in your work, Mo, very clearly. So I think we need to learn from that and think about how we can make sure that that approach is taken in all the work that we do. So I'm very encouraged and very pleased about the outcomes of this webinar, which will feed in, as we've said, into our policy reports, which will be coming out early next year. And then we will have a very good evidence-led basis for making the case to even more strongly to organisations like the WHO and others internationally and regionally and nationally as well. So thank you everybody for taking part.
No, thank you very much, Peter. And I just want to again thank our presenters tonight. Thank you, Mo, Richard, Amon, and Peter, for your time and expertise and being so gracious with sharing not only the work that you're doing, but being part of this discussion. Thank you very much to all of our participants from all around the world. I'm sorry if we didn't get to everybody's questions. We will try and take them on notice and get back to people who asked. And thank you also to people who have been putting in information about various documents and reports and things. That's incredibly useful, and it will feed into the Men and Cancer report that we are preparing. And if people are aware of other documents, please send them to Peter afterwards, and we'll send out a notice with the at the conclusion of this webinar. It will be put up online for people to watch again and to share with other colleagues, and we'll also let people know when the that report is available early next year. Now we've come up to 30 minutes on the hour, so that is 90 minutes. Thank you all very much for your time. We really appreciate it, and we'll end the webinar here and wish you all a very good morning or good evening, depending on where in the world you're joining us from. So thank you all very much.
Thank you.
Thank you. Bye-bye.
Thank you.
Thanks.
Bye.